Perfect Balance Healthcare presents Lick, Stick, and More with your host, Dr. Nandita Koodie. Join me to explore the minds of thought leaders as they share golden nuggets on the impact of faith integration in practice, professional development tips, and innovative solutions to bring you beyond ordinary healthcare. Thanks for joining us today for our episode on pharmacogenomics. We have with us today Dr. Jamie Wilkey, who's not just someone I'm trying to get to know today, but happens to be a good friend of mine. Jamie, thank you so much for joining me today.
Yes, my pleasure, Dr. Koodie. I'm always excited to have another chance to talk with you.
Yeah, so I'm just going to dive right into it. I wanted to get into a little bit. I know when I first met you, you weren't doing pharmacogenomics. What were you doing about a year ago when I met you?
Well, this time last year, I was still working at Walgreens and feeling frustrated and stuck in a job that I felt like didn't suit me very well and felt like, I don't know what I'm going to do with the rest of my career. Can I really do this another 20 or 30 years? No way. So I felt stuck and frustrated and looking for something more, but couldn't find it.
But you were definitely exploring other options because I think when I met you, you were doing something along dermatology. Is that right?
Mm-hmm. Yep. I was just looking at anything I could possibly get into and was wide open for opportunities.
So that's something I wanted to kind of encourage people who are listening and viewing that they're not sure where they want to go, and it's hard for them to get into anything without committing 150% because we as pharmacists are definitely guilty of doing that. But it is totally okay to try something, pivot, and do something else that suits you better. I'm a firm believer that getting out there and seeing what's available to us to help patients reach their health goals is one of the best things you can do. Is just get out there and explore and see what other people have that they're doing, how they're doing it, and see if it interests you. And that's why I have Dr. Wilkey here with me, is to share with you how you can get into doing pharmacogenomics full-time consulting if you really wanted to. How can you build a practice on that service? And so when did you register your business?
So last year, about a year ago, I registered my business, Arches Health Group, and it was the first step. And it was pretty exciting because once you start taking action and stop overthinking things and just start doing it, the pieces fall into place. And either you realize this is what you're really interested in and you want to go full force into it, or you feel like, I'm glad I'm taking action, but maybe this isn't for me. And you, like you said, you pivot. So action solves all the worry that's in your head, just taking action.
Why Arches though? Were there other names that you were dabbling with and you're like, you know what, maybe I'll just do Arches because
I live in Utah and I love Arches National Park and I love all of our national parks out here in Utah, and just wanted to stick with something that reminded me of Utah and what I love, but also wasn't branding so specifically to get myself in such a niche so that I can expand and pivot within that umbrella name.
That's definitely a point that I share with clients. Don't limit yourself with your business name. Don't limit yourself. She didn't include the word pharmacogenomics or PGX anywhere in her business name because it allows her to do something else with that business without having to register another name or another DBA. And if you want to get into some of those things, you can always contact Jamie or contact myself, and we'll be happy to share with you exactly how to go about doing that and what that means. But one other tip that I usually give people who are looking to starting their own consulting practice and they're trying to pick a name, pick a name that starts with A. Why? Because in listings, maybe you're at a dinner series or maybe you're at a conference or something, the letter A people are going to be listed alphabetically at the top. Okay, so the most recent business name I came up with also starts with A for that reason. So how did you get into the idea to starting your business? What allowed you to pivot from the dermatology realm into the molecular realm?
So I've always been interested in pharmacogenomics for the past couple of years because I had a really close family member who was prescribed the wrong medicine, and it sent her to the psych ward of the local hospital for 2 weeks, not once, but twice, and it just completely turned her young family upside down. And so to see what an adverse medication reaction really looks like in real life and to see how much it impacted her family made me feel like, not only from a pharmacist standpoint, but from a human standpoint, like, we've got to do more. Our profession has to do more. If adverse drug reactions are the 4th leading cause of death in the United States, that's something we can make a big impact in. And it felt like a bright spot in the future of pharmacy, because a lot of pharmacy is saturated and is going in a direction that most people aren't happy with, at least in traditional pharmacy roles. And so seeing the power of personalized medicine and how we can help our patients understand their health and be empowered when they're talking with their doctor, starting at their DNA, really felt exciting. And so I took a PGX certificate course, and after I went through that training into understanding what pharmacogenomics is, I felt like, whether I like it or not, I have to start a business, because people need this, especially after going through COVID and seeing the mental health crisis and how poorly mental health is being managed. When you can have guidance in dosing these medications, it felt like this is something we should be responsible for and should be doing as pharmacists. And so whether I like it or not, I've got to get out there, like, partly out of my conscience, like, no one else is doing this. Why? Let's get out there and start truly helping people in a meaningful way.
Yeah, absolutely. So, I wanted to dig into that just a little bit. You had mentioned you did a certification course, and I feel like pharmacists, sometimes we can get stuck getting ready because we're going to do this, because we're going to have to do this, and then we can do that. Do you really honestly feel like a pharmacist needs that certification course that you did, or one similar to it, or would just working with someone like you or I be sufficient and qualify them to provide this service? I feel like a lot of us, we don't give credit enough to our doctorates of pharmacy. And we don't realize how well qualified we already are to do a lot of the things that we're considering doing or trying.
Yes, absolutely. And that's exactly what I teach in my academy to pharmacists, is that idea that you are a doctor of pharmacy. And if you're a bachelor's in pharmacy, you have decades of experience. You can do this. And it's not required to interpret these tests. I did it because at that point it was some CE that I needed anyway to keep my license. So I felt like, yeah, sure, two birds with one stone, I'll get it. But really now, the labs I'm working with are really rolling out the red carpet, and they want to help pharmacists understand PGX and be confident in it. So even the labs are starting to offer free education for pharmacists to help them feel more confident in this. So you certainly don't have to be certified. No patient is going to ask to see your certificate before they talk to you. If you're feeling really unsure of the knowledge, there are so many resources from us, from the labs themselves, to a full-blown certificate program. But like you said, you can spend forever procrastinating in the form of getting education, but until you actually do it, all of that information in your brain isn't doing anyone any good. And it's actually been pretty interesting, because so I have a certificate and I've been seeing patients for a while, so I have some pretty good clinical knowledge. But I've had so many pharmacists who have gone and got a master's degree in pharmacogenomics, or even PharmD and PhD pharmacists who have a PhD in pharmacogenomics, that are still reaching out to me and saying, like, teach me how to build a business with it, because they have the knowledge, but until you put it into action, it's not helping anyone. And so we as a profession love to get more knowledge, but until we're like getting out there and helping people, it's just a form of procrastination. So there's so many resources to help you, especially living in 2021. There's never been a better time to pivot, because the resources are there, like handed to you on a silver platter.
Jamie, you and I should open an academy like the X-Men. I think we should, and I think we should just take all of our mutant pharmacists that are tired of the traditional role and train them in entrepreneurship, because we really need to exemplify all of the special powers that pharmacists have. So what do you think about that?
Yes, that they have, and they just they take for granted and think like, well, there's nothing special about me. I couldn't charge for my services. I don't know how to do anything. But truly,
they're already doing it for free.
They're doing it for free. Like, there's so much out there as far as ways you can help patients in so many different avenues on the needs of their community and what you're actually interested in. It's not like there's one cookie cutter option to get out of traditional pharmacy. To me, it's like a whole menu of options on how would you like to build your career, build your practice in a really great way that will, and many times, pay you more than you're being paid in a traditional setting and have huge rewards in patient satisfaction and happiness and the value you're bringing to the community. So I love this space because there's nothing but opportunity. There's not competition at all. And you can't say that for many parts of pharmacy.
I think that's just it. I think, and I say this a lot, we competed to get into pharmacy school. And then we competed to stay in pharmacy school. And then we competed to get a job. And now we're competing to keep our jobs, in a disposable market. It's so refreshing to finally be at a place where we can be comfortable working alongside others in our profession and it not be about competition, but really uplifting each other and unifying to bring patients to better care, which is really what we pledged an oath to do. And to not have to worry about the fears and the doubts and the threats that come along with just little seeds of doubt that are placed there by predecessors or that are placed there by colleagues that we work with or leaders even that we are following. And so how refreshing. I remember the first time I met you, you were like, so what do you want? What's the ulterior? I'm like, I want to work with you, show me how we can help each other to grow, as consultants and as pharmacists who are doing something out of the box. What is it that I can give you and what is it that you can give me that we can help each other and put our heads together to move forward as professionals? And that's the beautiful thing about it is, you don't have to give with a closed hand. You can just give openly. It doesn't even have to be that I'm getting anything in return, but I just want to see you, just watching you grow, Dr. Wilkey, has been such a pleasure for me to see you blossom into who you are now and to see you giving back to the community in the way that you are. I was so happy to hear a company had reached out to me to share with me their pharmacogenomics tool. And they're like, oh, do you know Dr. Wilkey? Because we're about to meet with her next week. I was like, do I know Dr. Wilkey? I'm like, she's only the queen of PGX in the pharmacy world. And the pharmacy world is not very big. When I moved here from Florida to California, I went to my first pharmacy dinner and somebody called my name. And I was like, who knows me on the other side of the nation right now? Like, what is going on? But the pharmacy world is so small. So I wanted to share with our viewers and our listeners a sample from that company of the actual comprehensive report that comes back. What is PGX? What happens? So, essentially a patient has a blood sample taken in clinic or in office, and they send it off to the lab for the pharmacogenomics company. And correct me if I'm wrong, Jamie, this is just, what this company told me their process was, okay? And they have a lab on site where they process that sample, and then they send you back a comprehensive report. And so this is the part that's scaring pharmacists away from PGX. Oh, it's too complicated. Oh, I don't have time. Oh, I didn't really study that in depth and I would need to get trained. No, you don't. This is what the report comes back looking like. You get a list of the patient's current medications, and they basically do a drug interaction report, basically kind of like what you're used to seeing, maybe on ClinPharm or some of the other tools that we have, Hippocrates, whatever, but it'll actually show you which ones are serious, actionable items, which ones are just informative, and which ones are, it's not really that big of a deal, don't worry about it, and which ones are, these you absolutely need to worry about. The patient has it literally will say insufficient response to whatever drug. And so it'll tell you why. It'll tell you what enzyme is responsible for that. And it might suggest to you what a more appropriate therapy is. So it's doing all of the work for you guys. Look at it. It's literally showing you the list of the drugs, the brand generic even, if you were terrible at your top 400 when you were testing for your state exam. It's telling you all of that for you in a way that you can just take that report to the practitioner and make meaningful interventions without having to invest oodles of time into a certification or trying to analyze that test. Tell me, Jamie, is this not just the best kept secret of our world?
Yeah, it absolutely is. And to me, it's just one more tool in our tool belt that we can use. And when you can say to a patient, like, I will show you how medicine can work for you for the rest of your life, and shine a light on why this medication may not be working for you, or why you seem to have a lot of side effects when you take medication, patients are desperate for this knowledge, because without the PGX report, doctors are just guessing. They're making an educated guess, but they're just guessing and prescribing. And it's 2021. There's a better way. This technology has been around for more than 20 years, so it's not even like a new fad that's unfounded. There is so much clinical evidence now, and that's pouring in for so many disease states that are really helping patients get the right therapy that they need, from oncology to pain management to mental health to cardiovascular, even diabetes. Like, the list is growing of health conditions that patients are suffering from, where personalized medicine is helping them. And so it's not that I just look at this report and just do that. I do it as part of a comprehensive medication management program, where now I bring it in under the umbrella of everything. And we're looking at not only drug gene interactions, but drug interactions and drug food and supplement, and like bring all of their medicine to the table and see what's going on. Why are you taking this? Do you know what this is for? And having that conversation from a pharmacist perspective, rather than just looking so narrow at drug gene interactions. Sometimes pharmacists say, well, like, the report's doing it all for me. The doctor's just going to look at it, and like, what do they need a pharmacist for? But they need a pharmacist to interpret that complicated report and to bring the greater scope of medication management. And so it's a really exciting and rewarding place to be. And I've even had patients like start crying on me when I was going through this report, because they were saying, like, my depression's just never been managed well. And now that I see that it wasn't me, it wasn't my fault that my depression medicine wasn't working, that like that wasn't the right medicine for me, is such a relief, because I was so hard on myself, wondering what was wrong with me. Mm-hmm. And to be able to have that as a piece in the puzzle has been really rewarding.
Yeah. At what point do we consider God's perfect design for us as individuals and put that into play with regard to creating our medication regimens? So I'm just going to get into the dirty side of this. These tests are expensive. Okay, they can be. Let's be honest. How are we getting around that? How are we making this accessible to patients? How are we allowing this to create a practice that is profitable on the business side of this conversation? Tell me a little bit about how PGX has been presented by you to other practitioners in a way that it's no longer a fear as to how patients are going to get access to this. Because I'm going to tell you, like, it's tough having the conversation of cost for anything with practitioners who are struggling with patients who are on county-based systems, Medicare, Medicaid, and there are so many restrictions and red tape around reimbursement and costs for different things. You know, how do you approach that conversation, and how can you encourage pharmacists to still take this on as an opportunity for them in their consulting practice with regard to that aspect of it?
Oh yeah, well, it's a good time to be in PGX, because the acceptance of it is growing and gaining momentum. Right now, Medicare will pay for it in specific populations, as well as United Healthcare. And just recently, CMS looked at expanding their coverage for it, and they're reviewing that actually like right now. Mm-hmm. And so insurance sees the value in getting patients on the right medicine for their body and how it saves insurance so much money. So I think over the next few years, you're really going to see insurance covering it more. In some states, Medicares are paying for it. And so it's not that no insurance is paying for it. It's just a tricky line to walk to make sure that insurance is covered. And so if the population really can't afford any out-of-pocket costs, then going through the systems helps, and there's ways to do that. But from the business perspective, if insurance doesn't pay for it and you're in a population where patients are willing to pay and have some disposable income, then you'll be really surprised and pleased to see how much patients are willing to get these results and to help themselves or help their close family members who are suffering from medication. Because truly, it's not expensive. It used to be thousands of dollars for these tests. Now it's down to a couple $100 and dropping as more and more labs are popping up and they have to compete based on price. And so even if insurance doesn't cover it, a lot of the labs I work with have cost assistance programs where if a patient qualifies, then they're paying $0 or a lower cost for the test. And then the pharmacist just gets to figure out how they get reimbursed for their services, whether it's a payment plan or structuring it along with greater services. You can make this work, and you can make it work quite well. And I don't want pharmacists to feel like insurance has to cover 100% or else I can't succeed. Mm-hmm. Yes, there are places for insurance to cover it and ways to go about that. But if you're willing to put yourself out there and show the value of a pharmacist and charge for the cash price, patients are more than willing to get help like this.
So I started off doing cash-based services.
Mm-hmm.
Cash-based MTMs, grocery walkthroughs, cost savings programs. And I was looking at doing cash-based PGX, but the cost of it was like so high. I was like, I don't know how I'm going to do this. So I really dedicated the last year into looking into different services that we can provide that are reimbursable, mm-hmm. and not being so afraid of billing. Mm-hmm. I feel like this is a dirty word in pharmacy, and it's something that scares us because it's a challenge for us behind the bench dealing with all of these different third-party payers and trying to make sure the claim goes through, because if it's not free and if it's not ready now, the patient doesn't want to hear about it.
Yeah.
That's the culture that we've created as pharmacists, but that's not true. People were paying me cash. So yes, that is an option. However, yes, we can bill for this. And if you're interested in billing for it and you want to find out the different avenues that it is billable, feel free to reach out to Dr. Wilkey or myself, and we'll be happy to guide you to that information as well. So like you, I have a passion for helping other pharmacists get out of their cycle, break it, and get into doing their passion project as their full-time. Okay. So, but I want to know, how much money have you wasted so far that you'd like to spare others? If you could just quick tally in your head, just start rattling off some of the figures that you've wasted over the past couple of years getting to where you are. And what does that figure look like that you could save other pharmacists that are thinking, and a lot of times we're like, we're just going to do it ourselves because it'll save us a lot of money. And, I can just figure if it's being done, I could figure it out somehow on YouTube. What?
Yeah, I'm glad you said that because I did that. So I spent like a whole year trying to figure out how to do this by myself because truly there wasn't like a program that I could see out there to show me like how, there's the certification to get the knowledge, but how do I actually like create a business and mm-hmm. start charging for my services and like that whole how part.
Yeah.
I knew the knowledge, but I didn't know the how. So I had to figure it out. And this was while I was working at Walgreens. So my nights, my weekends, taking days off. If I had been working at Walgreens, making my $60 an hour at Walgreens, I would have earned $30,000 to $35,000 more over the course of last year if I had put all that work at Walgreens into what I was doing for building my business. Mm-hmm. And so time is money. So even if consulting doesn't cost a lot of money to start up, because what you're paying with is your time is so valuable. Don't waste it trying to figure it out yourself. Build on the shoulders of giants like I did. I reached out to Dr. Nandita. She helped me. I'll help the next person. Like, we just pay it forward. You don't need to figure this out yourself. Don't reinvent the wheel.
Not alone.
Because when I see pharmacists do that, they start losing momentum and start giving up when it gets hard. Mm-hmm. And so not only is it dangerous because you're eating all of your time away, but the momentum you're going to lose, and to feel discouraged and feel like, well, man, this is really hard. Maybe my job at CVS isn't so bad after all. You know what? I actually really like CVS. It's fine. It's so hard to build something yourself. That's not what we want for you.
I mean, honestly, my next question was going to be, what is the most precious commodity for you?
It's time.
Okay.
Time.
And so for me, faith is first. Mm-hmm. I'd say 75% of me getting here was definitely faith. I could not have did this on my own. It was not my strength. It was the coattail of Jesus Christ that I wrote on all the way over here and doing my consulting practice. Okay. That was a huge leap of literal faith. So that was my number one commodity. But the second one was definitely time. And this is something I want to shine light on with everyone that I get a chance to speak to. What was it that happened? Or what was it that you did that allowed for you the time to grow this?
I just had to be so specific about my time and how I was using it, and to work as efficiently as possible, and to just spend it with people like you, people who've already gone 3 steps ahead, to learn from them. So I just spent so much time on the phone with anyone who would talk to me to find out, how did you do it? What advice do you have? What pitfalls can I avoid? And just failing forward, and just failing and saying, okay, that didn't work. Let's keep going, and has failure as a path to success, rather than seeing a failure and then turning around and trying to figure out a different direction. Nope, failure is on the path to success, and just failing quickly, and keep moving forward.
And let's save you a couple $1,000s in the process. I know it took me $7,000 my first year to get the business off the ground. I remember calculating that on my spreadsheet and being like, really, Nanny? Did you really put $7,000 into this business that's really not doing anything right now because you've just been preparing to prepare to do something? And I was like, well, I need to have a reality check here with exactly how I'm spending my money. And then I ended up closing myself off more from people because I had been burned by, things of the world that seemed to be the way and weren't. I was fully qualified the whole time to do everything. And, one of the best things I did though, was I got a coach. And that's what I want to encourage people to do is, you're not alone. We're here. We've been through it. We can save you thousands of dollars. We're not going to charge you, a ridiculous amount of money as other coaches will to put you in some sort of a membership-based program or something. But, I and I know Jamie would probably offer as well, real one-on-one true information and serve as a resource for you to help you get where you're trying to go, and to even identify what you want to do. I think a lot of pharmacists are stuck at the point where they're like, I really don't know what I want because I don't know what's out there, and so we are not just pharmacogenomics. We've seen and we've explored other things, and we have that as a resource to share with you as well. So, tomorrow isn't promised, right? And we can't make more hours appear in every day. We have to figure out how we're best managing our time. What tools do we have that can help you do that? And, and just recognizing that the enemy uses things like money, pride, procrastination, possessions as distractions from you doing what you were called to do. And so you hear that little voice in your mind and in your heart telling you, you should probably do this. It could benefit your patients and your profession. But you're like, no, that's really hard. And I'm really comfortable where I am. And things are actually going well. And if I just save a couple more dollars, then I'll be able to do this. No. You have to, at some point, trust that God can provide for you and that his grace is sufficient for you to do what you have to do. Is that not the truth, Jamie, honestly?
Oh, yeah. You just have to be really good at getting uncomfortable and doing it anyway, even if you feel uncomfortable or scared or nervous.
Yeah.
You just do it anyway.
So as a pharma mom, what's one tool that you can recommend to our viewers and listeners that you feel like has been instrumental in you really managing your time and finding laser focus on what you're doing?
That's a good question, because I have 4 little boys, ages 3 to 9. So they're quite young. They need their mama a lot. And I just use the calendar app on my iPhone, and I follow it religiously, and everything that is scheduled goes on the calendar. And I have a notebook that every single conversation I have, even with us today, I'm writing down everything that was said. Not everything that was said, obviously, but like write down the highlights of what we said, what my action steps are. And then in the coming weeks and months, when I say, oh yeah, I talked to Nandita in June, what did we say? To go back to that rather than relying on your brain for everything.
Absolutely. So do you have a verse of scripture that stands out that was instrumental to you in your journey, that you feel like, there's something that you heard or you read that you felt like really spoke to your heart and helped you to get where you were going.
Absolutely. And scripture and prayer and meditation are the start of every day for me. I don't start work without having time to pray and to read scriptures and to start my day off with the right intention and with God as my focus, because that's the true purpose of my life. And when I focus on him first, then everything else falls into place. Rather than waking up and starting right on my emails, then it sets myself up for a day that's frustrating. So one of my favorites that I've always liked since I was little is trust in the Lord with all your heart and lean not unto thine own understanding. In all thy ways acknowledge him and he shall direct thy paths.
Wonderful.
That says it all.
Yeah, Proverbs is definitely a great book to go to for little tidbits of wisdom, for sure. Thank you for sharing that. And yeah, setting the tone for your day is so important. Not just getting off the bed and then sitting on your phone for 15 minutes before you actually get up and go, but actually really just setting the tone and quieting your heart and your mind to receive what he has for you today. But I just wanted to close by saying it has been such a pleasure to have you on the show. And it's so nice to see you again after a year of us going in all these different directions and basically winding up in a place where we can support our profession and help share out the positivity that comes with uplifting each other. And so thank you so much for joining me today. And I pray that God just be with you and that you feel his presence as you move forward and leading others to working for him. So thank you so much, Dr. Wilkey, and I hope you take care and stay safe.
Thank you, Dr. Koodie. Always good to talk to you.
Thank you. Thank you for listening to this episode of Lipstick and More. Subscribe and follow us on YouTube and all the social media sites at Perfect Balance Healthcare, or visit us anytime at pbh.life.